Hey there, dental enthusiasts! Did you know that acute apical abscesses are more common than you might think? In fact, they affect a significant portion of the population, making it a pressing issue in the world of dentistry. So, what exactly is an acute apical abscess? Well, it's a serious dental condition that occurs when bacteria infect the soft pulp of a tooth, leading to a buildup of pus at the tip of the tooth root. This is considered a dental emergency because if left untreated, it can result in severe pain, swelling, and even systemic infections.
FO are those who will encounter this question during board exam. Don't worry, because we will explain this question in order to find out the answer. So sit back, relax, and enjoy learning. Comparison with other conditions. Acute pulpitis involves inflammation of the dental pulp. Causes severe, sharp pain, especially in response to thermal stimuli. Typically does not cause systemic symptoms like fever and malaise unless it progresses to an abscess. Necrotic pulp refers to the death of the dental pulp tissue. May be asymptomatic initially, but can lead to secondary infections such as an apical abscess if untreated. Systemic symptoms are more likely to occur if an abscess develops. Chronic apical periodontitis, a long-term inflammation of the periapical tissues. Typically causes mild to moderate, intermittent pain and discomfort. Often asymptomatic or presents with a sinus tract. Systemic symptoms are rare unless there is an acute exacerbation.
In the middle of the night with excruciating tooth pain that radiates through your jaw. That could be a sign of an untreated acute apical abscess. Not only does it cause unbearable discomfort, but it can also lead to complications such as bone loss, tissue damage, and in severe cases, even sepsis. Primary culprits behind acute apical abscesses are dental decay and infections. When tooth decay penetrates the enamel and reaches the inner pulp, bacteria thrive and multiply, causing inflammation and infection. Poor oral hygiene, untreated cavities, and previous dental procedures can all contribute to the development of this painful condition. Brace yourselves as we delve into the stark reality of an acute apical abscess. Let's take a closer look at real-life footage and images of this condition to truly understand the severity and urgency of seeking treatment. The sight of a swollen, pus-filled abscess will undoubtedly highlight the importance of addressing this issue promptly. Found this information valuable? Don't forget to give this video a thumbs up and subscribe to our channel for more insightful dental content. We'd love to hear from you, so feel free to share your own experiences with dental emergencies in the comments below. Together, let's spread awareness and promote oral health in our community.